Now, what about the differential diagnosis of hepatic abscess? Hepatic abscess might mimic some of the conditions like amoebic or echinococcal lesions. Amoebic or echinococcal lesions can mimic the hepatic abscess. Similarly, if there is any simple cyst with hemorrhage, the simple cyst with hemorrhage might also mimic this hepatic abscess. Or if the patient has any hematoma, or if the patient has necrotic or cystic neoplasms, these can also mimic this hepatic abscess. Then, how are you going to confirm the diagnosis? So, diagnosis can be confirmed rapidly by doing an ultrasound guided liver aspiration, because already once the abscess becomes liquefied, we can aspirate the liquefied portion of the abscess and we can send it for histopathological examination and also for microbiological examination, where aerobic and anaerobic organisms are seen in culture. Then, among 50% of abscesses, in all these 50% of abscesses are cannot. So actually, mostly you will in the ultrasound guided aspiration we can get aerobic and anaerobic organisms, and we can identify it by culture. In 50% of cases, actually, because it is this aspirated material must be sent or must be transported, that is the specimen which is obtained through this aspiration, that specimen must be transported in an oxygen free container, because if it is present in oxygen, in a container with oxygen, all the anaerobic organisms are dead. So if you remember, in the first I said 50% of abscesses, 50% are actually anaerobic. Okay, so these anaerobic abscesses, if not transported properly, okay, that is if these are if these come in contact with oxygen, that means these if this specimen comes in contact with oxygen, then the anaerobic organisms which are responsible for the uh, liver abscess, these are killed. So as a result, the result will be sterile. Okay, though there is some infection, it comes out to be sterile because of failure to transport the transport the specimen properly. So that is the reason why we can say that, yeah, 50% of them have no cause and 50% have cause, because here cause is identified. Here in 50% of cases, the cause is identified. And these 50% of the cause in the hepatic abscess, in 50% of cases, it is caused by anaerobic infection. And this anaerobic infection detection is missed. And thus, in 50% of cases, no cause is identified. So, the one which I have said is wrong. Actually, this is the reason, this is the meaning. So, in hepatic abscesses, 50% of cases, no cause is identified. Why? Because the identification of anaerobic infection is missed due to the failure to transport in oxygen-free environment. Because the specimen which is obtained by aspiration should be transported in oxygen-free environment. But if it is not transported in oxygen-free environment, then the cause might not be identified. Okay. Okay. Then obviously, how are you going to treat this abscess? Okay. The treatment of this abscess is, one, you can give a antibiotics can be given to the patient, and the abscess can be drained percutaneously using ultrasound guidance. Abscess is drained, or drainage of abscess, percutaneously using ultrasound and CT guidance. Using ultrasound and CT guidance, we can drain the abscess percutaneously. Okay. So this is about the bacterial diseases, or hepatic abscess. Thank you for watching.